Hello, welcome to the Coeur Pediatrics educational video series. Today we're going to be talking about Croup. Now you have to remember that these educational videos are not meant to make a specific diagnosis about your child or to provide specific treatment plans for your child. They are informational only. If you have specific concerns or questions, it is important for you to talk to your own primary health provider. Now, Coeur Pediatrics always has same-day, next-day appointments available for patients who need to be seen within a short period of time. And at the end of the video, we'll be talking with you about the phone numbers to get in touch with our staff at Coeur Pediatrics if you would like to make an appointment. Today's topic is that of Croup. And Croup, as you know, is a very common disease. You've heard about it a lot. It is a viral illness that causes a very characteristic coughing, kind of a barking cough or a seal-like cough. Usually occurs at nighttime, and we will get hundreds of calls about Croup on a yearly basis. I'm sure that you or your family members have dealt with Croup in the past. I want to give you a little idea of what Croup is and what the treatments are that we deal with and how we deal with Croup. First of all, Croup is a viral illness that causes irritation of the vocal cords of the airway. And when the vocal cords get irritated, there are two things that really happen. And both of them are related to what goes on through the vocal cords. Number one, as you know, we talk through our vocal cords. And so when the vocal cords get irritated, they get swollen. And when that happens, the voice sometimes gets hoarse. We may call that laryngitis. And also, you notice that the coughing, or the noise you make when you're coughing, is this different consistency or different characteristic, which is that barkiness. That is due to the swelling of the vocal cords. The second thing you do through the vocal cords, of course, is you breathe through the vocal cords. And if your vocal cords are swollen, it's very difficult for you sometimes move air in and out of the vocal cords, and you'll make noises, and the vocal cords will vibrate when you're breathing through them. And so you'll sometimes hear an inspiratory stridor when your kids are breathing. Now, Croup usually is worse in the evening time or at nighttime. And this has to do with the characteristics of our human body. And our body in the daytime is slightly tense, and we hold our muscles are a little bit tense. But at nighttime when we relax, all of our muscles relax. And that relaxation occurs in our vocal cords too. And those are muscles that pull our vocal cords apart during the daytime, but at nighttime when our bodies relaxes, these muscles that pull the vocal cords apart relax also. And when this happens, the vocal cords get closer together. When they do, then you notice this obstruction of your vocal cords it's much more apparent at nighttime when kids try to relax. Sometimes the vocal cords are so swollen that they vibrate against each other. When this happens, kids have this coughing episode because the vocal cords are irritated from this. This is why you have the barking cough, worse at night, with some breathing noises, sometimes working hard to breathe also. The treatment of Croup, since it is a virus, is not in antibiotics. And basically the treatment is symptomatic, meaning we're trying to reduce the symptoms of this particular illness. Now, there are things you hear about. Number one is you hear about sometimes going out and breathing cold air. And cold air helps by reducing the swelling of the vocal cords. Now you have to realize that just like if you sprain your ankle, you put ice on your ankle, ice reduces the swelling. The same thing happens with your vocal cords if you put ice on your vocal cords. And you do that by either breathing cold air in, which hits the vocal cords and causes swelling to reduce some. Or some kids will get better by drinking ice cold water or popsicles or things like that, and that cools the vocal cords by the way of the esophagus when you're swallowing the ice cold material such as popsicles or water or juice. The second thing that you hear a lot about for Croup is that you want to go ahead and use a vaporizer or humidifier. And so what that does is it doesn't reduce the swelling of the vocal cords, but it makes the vocal cords moist. And so if they happen to be rubbing against each other, they slide against each other instead of rubbing against each other, so much less irritation and much less coughing. So when you hear about over-the-counter or regular treatment, home remedies for Croup, it has to do with breathing ice-cold air, or drinking ice-cold water, breathing cool air, such as bundling the kids up, taking them outside and having them breathe air, and also using a vaporizer humidifier. Most times this takes care of things. However, there are some times when the kids are working so hard to breathe that you're thinking additional treatment may be necessary. The additional treatments are available for Croup, usually a prescription type of things, and they're not used very commonly, but sometimes they can be very valuable. One of those is the use of an epinephrine treatment, or as a breathing treatment, that you breathe a particular medication into your lungs, epinephrine, and as it goes through the vocal cords, it reduces the swelling. This is usually done in the hospital, requires a hospitalization or at least an emergency room visit. The second treatment that sometimes helps is the use of steroids. And steroids work by reducing the inflammation in the neck to reduce the swelling. Usually takes a little bit of time, a few hours for steroids to work, but that is another option. If you are at home and having a child that has croup, the first thing to do is take them outside, breathe cold water, have them drink ice cold water, and then to use a vaporizing humidifier. If your child continues to work hard at breathing, then I recommend bundling them up and taking them to the emergency room if this is happening at nighttime. If, however, you go to the emergency room and you pull in the parking lot and look at the back seat and your child's sleeping soundly in the car seat, that just meant that you were outside long enough to reduce the swelling of the vocal cords. You might as well just go home. Now, if your kid's still having breathing issues by the time you get to the emergency room, it's worthwhile to go in and have your child checked out to see if the other treatments may be necessary. If you get through a night and you say it was kind of a rough night, you'd like to have the child seen the next day in an office, please make an appointment with your primary care doctor. At that time, they can assess whether or not prednisone or the steroids would be appropriate for your child and make sure that you're doing well with a particular illness. That's croup in a nutshell, and I hope this provided you some information about croup. It's a very common childhood illness. We want to let you know that, again, that our office is available for same-day or next-day appointments. Our office can be contacted by calling our office number, 208-667-0585. You can also get additional information concerning croup or other illnesses by looking on our website, www.cdapeds.com. Thank you for your attention.